I'm Christine. Welcome to the Recovering Perfectionist podcast, where I empower you to develop sustainable habits, challenge society, and take messy action. It's time to align with the universe for the full human experience and redefine what it really means to be successful.
It's too good, the secret is out and wow.
Welcome back to the Recovering Perfectionist podcast, the official podcast of the dance wellness community. And I am so very excited today to introduce you to one of our newest practitioners. His name is Philip A. Croatan, a health scientist. Guys, you have no idea what's about to come here. This is amazing. He's a physiologist and a CEO reshaping 21st century whole person healthcare. He's the co-founder, CEO, and chief clinical director of Proprioceptive Solutions, which is the first movement hospital in La Jolla, California. Like, where do we even begin? Welcome, Philip.
Thank you for having me. Thanks for having me. I appreciate it. I'm happy to be here.
Absolutely. I am so very excited. We have been introduced to each other through one of our fabulous ambassadors, Tony Nunez. Shout out to him because we love him.
Tony's great. I love Tony.
And you also said you worked with Yuki Haraguchi, who's also one of our ambassadors.
Yeah, I've had the absolute pleasure of working with a lot of the great dancers who just kind of welcomed me in and ushered me along the way. While I've kind of been in all musculoskeletal care, the ballroom dancers have really given me a niche out here in San Diego. So
Yeah.
it's been great.
It's amazing. So first, I do want to ask you kind of our general three questions so people know what they're getting themselves into. And then we're just going to kind of dive deep into it because, guys, I was able to be in La Jolla a week ago. I was able to tour this incredible facility and see the impact and the innovation that is happening there. And I'm just so excited for you guys to understand what we're going to dig into here and what we're doing by bringing Philip and collaborating here because there's so many things that are now going to be available for our community. So first, I want you to tell me what you specialize in specifically.
Primarily, I specialize in biomechanical assessment and clinical decision making. I do pathophysiological narratives for practitioners that are medical professionals, clinicians, dietitians, really understanding how the musculoskeletal, metabolic, and sometimes biochemical interactions of the internal environment end up presenting pathologically once some type of etiological disease presents to start with. And it doesn't have to be a biochemical disease. It can be movement dysfunction as well. I specialize in identifying what the issue is and then providing a narrative that supports a clinical decision. And I'm surrounded by an excellent team of clinicians who then are specialists that carry out the process.
Amazing. And how long have you been doing this? I know that you've had the facility, I think we were talking about going on almost a year.
So I've had this facility since September 2024.
Oh, that's right.
We opened up operations January 2025. So I've been operating, I guess about 12, 13 months now.
But you've been doing the coaching privately and, with your degrees and everything for a lot longer.
Yeah, I've been a physiologist for quite some time. I've been in my field for about 14 years now. And just been building along the way, upskilling, hopefully becoming better at what it is that I do.
Yeah.
I've been in it for some time.
I love that. And specifically, because obviously when we talk about what you do and athletes, I mean, you can help really anybody. But I would say not just your target client, but what are the clients that are coming to you that you really can help at their fullest? What kind of things are they coming to you with? What kind of symptoms? Who are the people that you really help the best?
Well, it's interesting. Being an outpatient care facility with the movement hospital category, we see a breadth of different people. I mean, I see at least two patients in their 90s. week.
Wow.
Um, and I also see, a young man about 16 years old a few
Yeah.
times as well. So we cover the span, to be honest. Um, Primarily, we have about 11,000 square feet that's dedicated to human performance. So in there, you'll see a lot of your young adults, maybe 25 to 45 in there, more self-guided than anything. Uh, and then we have another maybe 5 to 6,000 square feet that's dedicated to orthopedic rehabilitation. And so you have some of those people trickling up as our entire facility provides a semi-supervised environment. So whether or not you're training on your own, or if you're with us for something more orthopedic rehab, recovery, corrective
Hmm.
exercise, you're dealing with an entire interdisciplinary team. And then the remainder of our 22,000 square foot facility is dedicated to advanced recovery, holistic pharmaceuticals, apothecary, that type of thing. So we specialize
Mm.
with hyperbaric oxygen therapies, cryotherapies, uh, sauna, things of the sort like
Yes. That's amazing. That's the stuff I really get into. I really love all that, the
that.
the trendy buzzword, the biohacking of it all, but it's very,
Yeah,
very exciting. Yeah,
yeah, we get
very
a lot of those, especially from the angle of like peptides. It's becoming as
exciting. Oh,
really
yes.
really popular these days. And I think there's some merit to it. I see a lot of patients that have just undergone stem cell therapy.
Yeah.
Uh, and so they we put them in our hyperbaric oxygen therapy chamber for motility of the cells.
Mm.
So it's a lot of good that can be done here, even from the intravenous side, doing your happy infusion, vitamin B12. A lot of
Yep.
people come for those things.
Yeah, so our community is familiar with that. We do have our nurse practitioner, part of our dance sport medical team that does at our recovery lounges on site. We do the B12 shots, the IVs.
Awesome.
And so that is definitely, because people, the first thing they say is, I don't like needles, right? Who does,
Yeah.
right? It's not
I,
something we all want to do.
uh,
But it's definitely the thing. I think the B12 shots and the IVs, especially for high performing athletes, they're like, once they get over that initial, and then Kim, our nurse practitioner, is incredible.
yeah.
She's used to working on rodeo animals, so like you can't spook them. So she's like
Yeah.
so comfortable with like doing it in a nice way. And then
Uh,
they're addicted. Then they're like, every time I see you at a comp, I have to have my B12 and my IV.
yeah.
Non-negotiable. Um, here's the thing, when my husband and I had the pleasure of meeting you in person when we were in town for an event last week and seeing your facility, and you gave us so much time and gave us a full tour, even got to meet your beautiful wife and new baby. We're new parents, so we got to bond
Yeah.
over
Have
that,
a
which
lot
was
in common.
awesome. And the thing that struck me was this concept that you're calling a movement hospital, because to me, having a baby was one of the scariest things. I did not want to be in a hospital. I didn't want to call it a hospital. It was a birthing center. Even if they called it a hospital, I didn't call it that. That's a very
Yeah.
triggering word for a lot of people. But you're kind of trying to rewire our brains a little bit to explain that a hospital is a good place to get good care if there
Mhm.
is good care. And the
Yeah.
fact that you are providing this care in a very innovative and unique way is stemming from something that you had when you were playing football, you had mentioned.
Yeah. Yeah.
So I would love to get into that just a little bit.
Yeah. I'll go back a little bit to the hospital concept because the derivative or the etymological foundation of what hospitality
Mm.
is the same for a hospital. And the idea is to provide a place for care and treatment.
Okay.
Um, Hospitals have a very specific scope, and I don't want to be the one to push the narrative that there's no importance there. Um, Hospitals are more surgical intervention based. They're biochemical intervention based, and in the most positive way, they're for sick care. Uh, and I just think that we have a healthcare system that has been dominated
Mm.
by that because of the uh, the adjunct of like I want to say it was 1920s, 1930s, you started to see all of this biochemical type of warfare,
Hmm.
diseases introduced. So there's this onset for this need of just emergency care that
Right.
no longer had to deal with the experience. While there are many practitioners, primary care practitioners, chiropractors, physical therapists, physiologists who are scientists, some radiologists, dietitians who don't quite fit in that model. So a lot of the times they're working on their own in these silo spaces, even though they're supported by the same payer integrations, they're seeing the same patients. And when they're siloed like that, you reduce the access to this type of care. So, if someone doesn't have a lot of knowledge on what to look for. I take
Mm.
myself, for example. If you don't know what a physiologist is, you absolutely won't be looking for me in a Google search engine.
Yeah,
Um,
right.
so if you have a place that you can come that is movement based, you trust that there's a group of practitioners that have the professional licensure, the recourse in the event that something imprudent or unethical is taking place, the knowledge and the scope to assess, diagnose, treat,
Hmm.
then you go to that place. You have a better stratification system to know when to go to movement hospital as opposed to a rehab hospital or a general hospital or women's health,
Gotcha.
things like that.
Yes.
But based on what you said, I early on,
Yeah.
I really did think of having this being just a movement center, but it was already taken. Uh,
Oh,
so it led me more and more into a greater idea. And during my doctoral study, I had a professor who was the dean of our college tell me, Dr. Marie Hasty, tell me that it was my duty to push the professionalization of this field. And so much of what we did in that program was about building healthcare systems. So bringing
gotcha.
something that is accredited under the main regulatory bodies like the Centers of Medicaid and Medicare Services became something I want to do and ended up developing my thesis around it. So that's where that came.
Interesting.
But the experience I did get, you're right, early on in my collegiate football career, and even some in my high school career, because I went to a really great high school. Um, we had a strength and conditioning coach
Mm.
who programmed all of our movement interventions relative to strength and metabolic conditioning out for an entire year, knew what phases we were going to be in relative to the season of the sport. We had a
Wow.
dietitian who programmed all of our meals relative to it being in the morning or post exercise. You didn't have to think about these things. We had an orthopedic surgeon who would come in every other Monday, sometimes just for maintenance or to assess the injuries that we were dealing with. We had world-class athletic training staffs, which are essentially physical therapists that know how to approach contact injuries more readily as opposed to just pain management. So we receive the athletic trainers daily. So we
Mhm.
had an interdisciplinary team that was always treating,
And
assessing.
that for me is what lit me up. Like when you said that, I was like, that's what I'm trying to do with the
Mhm.
dance wellness community. Because eventually the goal here is to make it broader for all athletes.
Yeah,
And we're starting with our niche, but I have talked to former NBA players that say they don't have anything that you just described. And I'm
that's
like, in the NBA, like you're lying. And we've got, I mean, now obviously over the past years, we've had Simone Biles and all these people come out about their mental health and different
mhm.
things that there's just care has become what people think it is and not what people actually need, I think, in the bigger scope. And
Yeah.
even for the Olympians who we think would have the top care, it baffles me. So when you said that and you explained to us what you had, playing on your collegiate football, and that wasn't even the NFL. I was floored. I was like, wow, this
Yeah.
is incredible. Um,
Yeah.
that is the kind of interconnected team, the whole human, as you explained it,
Yeah.
what we're trying to do with this mental, physical, and financial side of things, especially the financial, when you think about all of these NFL players who are getting these huge signing bonuses and have no idea what to do and how to
Yeah.
invest it and how to, and then if they get an injury and they're done, there's so many people that just lose everything. And
Yes.
so there's so much that goes into it. So I got really excited about what you were saying because it's not even that it already exists somewhere. It's that we're feeling a gap in areas that it doesn't exist, but the fact that there's already some sort of a template out there that we can go from is kind of I feel like what you were inspired by to create your facility.
Absolutely. Absolutely. And you know what? I can only stand on the shoulders of giants. You know,
Yeah.
the administration, the previous administration already started putting this in place. Uh,
Yeah.
there was an extremely important piece of literature report that came out in 2001, and it was published by the National Institute of Medicine. It was crossing the quality, crossing the quality chasm when it was really just an outcry of
Mhm.
disappointment and dissatisfaction with the current healthcare system. And so much of the things that we benefit from today here in the United States have stemmed on the back of that. So I'm just
Right.
a piece of the continuum. I hope to be
Yeah.
a meaningful part with my contributions to this time that I have here. But there's been
Uh,
a great
I
work
think
done
it's
before.
amazing what you're doing. I
Thank
think I think for me, I'm all about the customization of the care that you're receiving. I think
you.
obviously that is the future of the present, but also very much the future of where care needs to go. Because with all the misdiagnosing and the fact that a doctor, if you're going to a doctor and they're really doing their job well, you shouldn't need to see them, right? They should be like, okay, you're done, you're good, you're healed, or
Mhm.
come see me when you need something else. But the fact that so many people are on continual, even, blood pressure medications and all of these things, that's just like things that are just routinely maintained, but they're never actually solved. They're just kind of like masking symptoms, which ends up in a lot of misdiagnoses and things like that. The customization of the care in this country is not what it should be, as we all know. But when it comes to athletes specifically, every athlete is different. Every athlete is going through something different. They have different medical history, all those things. So the fact that you are able to dive in so deep and focus so, beautifully on specific things and have so many different departments. I was like, this building that we saw, I was like, this is massive. And there are so many like specialty areas that I mean, you could treat anything in this with all of the departments that you have, which is absolutely incredible. And I know firsthand that when you get customized care, your and referral care, that people actually know what you need, then
Mhm.
you have a much better experience. And that just goes based off of when I had my son. I was referred to by the OB that was currently working with, and he's like, well, he wasn't really an OB that worked with delivering babies. So he's like, now that you're pregnant, I'm gonna have to pass you on to someone else. But he knew I was a little like, hospitals, squeamish. And so he's like, I know exactly who to pass you on to. And he ended up being super holistic, everything that I wanted, and one of the best in town because every time I mentioned his name to friends, they're like, how did you get in with him? He's like, I'm on his wait list. And I'm like, what? I was just referred to him. I don't know. I just showed up
That's
to his office, right? And so many of my friends who were prepared even more than I was. I prepared a lot, but prepared even more than I was with wanting to do home births and all these things, ended up all of them in C-sections. And
awesome.
I looked at my husband and I was like, how did we not, like, we were in labor just as long, we did all these things, whatever. And he's like, it was your doctor. Your doctor knew exactly what he was doing. He's done this for so many years. He wasn't scared at all. He did all the protocols and he made sure that you got the birth that you wanted.
Yeah.
And he knew it was possible. And I think a lot of the other doctors, they're just like, well, we've gotten this far. Like, let's just get it out. You know what I mean? And that's terrifying because for women, a lot of times they feel like they don't have a choice in that matter.
Yeah.
And that's just one specific thing. Here we're talking about athletes, but that's the experience I recently had with medical care. And it's can be one of the most terrifying experiences a woman can have.
Mhm.
And in her lifetime, and to get someone so specialized and so in tune with what you want that you can advocate for yourself. I
Mhm.
think that's what you're allowing people to do is you're giving people permission to say, hey, this is what my problem is, and this is what I need help with. And then you're giving them even an array of things that are 10 times more than the average doctor's office that you're going to get, or even like you said, some rehab care.
Yeah. I think that's some of the things that you were mentioning is why it's so important
Mm.
for um, for us to speak up and for us to lobby
Yes.
appropriately. You know, it's it's not that the physician that you'll find in a hospital by default has no competency, you know,
Right. No, not at all.
but relative to what he or she may may specialize in,
Mhm.
they're doing exactly that. Prescribing the pharmaceutical is what they do.
Right.
And a lot of the times what we're looking for, it is not what they do. You
Right.
know, in our field, about 85% of all ailments that
Hmm.
go into an emergency room are musculoskeletal in nature. And for musculoskeletal based practitioners, we probably need to see you, once, twice a week if you're actively dealing with something. Other than
Right.
that, you're coming in for something regular maintenance. Uh, a primary care physician may make a referral somewhere and then give you an at home prescription to do something.
Right.
And the level of adherence to the at home protocol might make all the difference. But if you don't have the know how, if you don't have the resources, if you don't have
Right.
the tools to adhere to that, you will end up back in that office.
Yeah.
There are specialists that exist outside of that nuclear institution, and that's what you're seeing kind of aggregate here together in a movement
Yeah.
hospital. It's 85% of everything else. If you came
Right.
to me and said, "Hey, I'm pregnant, we deliver my baby," I wouldn't be able to do much for you.
No.
I hold your hand and talk you through, and I call someone. Uh,
Right.
but that's not what we see on the regular. Thankfully, now there are women's health centers. You know,
Yes.
my wife and I, we were able to at the UCSD Jacob Center. Uh, they had within the maternity ward, there's an area for midwives and
Yes. And
and
doulas.
then doulas and something that they put
God bless them.
or you could bring your own. My
Yeah,
daughter,
right.
she was just classed as preterm, and
Okay.
granted, she came out very healthy, no problem.
Yeah.
Uh, but something that I did not necessarily have to worry about, and I'm definitely that helicopter.
Yeah, yeah, yeah.
Helicopter.
Well, with as much knowledge as you know,
Yeah,
I'm not surprised.
they
It's in
don't
the
like
best
me.
way. Yeah, exactly.
I guarantee you they remember my name.
Yes, yes.
But one thing I did not have to be concerned about is with the potential of there having to be a surgical intervention
Mm,
on that same floor, we do have an OB-GYN who's a surgeon,
right.
and so just creating the awareness, a lot of women speaking their voice, saying, "Hey, we need this, we want this, this is for our health." Uh, Now, an institution as large and notable as UCSD has integrated into, something
Yeah,
that's been around for quite some time. And I think there's only room for improvement. Don't get me wrong.
right.
Again, I'm a stickler, but I do think that things are changing because our voices are not only being loud, but they're unified today.
Right.
And so even, I love working with athletes, they get to come in here, they tell me this is like a home away from home because
Yeah, yeah.
typically they might be working with one of their clients or something. But
Hmm.
when they come here, they just get to be served. Well, we heard that. We
Yeah.
heard that complaint, the need. And sometimes they fall in the med spa, sometimes they fall in PT, sometimes they're falling with trainers, and they're not all communicating, and they're having to use too much of their own brain, too much of their own mind, spend way too much resources going to several
Right.
people. Now there's a system where the same payers that you're used to paying, at least the same payers that you're used to being in business with, insurance providers, FSA, HSAs, that you're using elsewhere can also be used here. But they can be used for things that you will use on a daily basis, as opposed
Yeah.
to the thing you're trying to avoid, like
Yes, yes, yes.
for diagnosis.
Well, and yeah, that just rang a bell with me because when you said earlier about the nutrition and the diet, that you things you don't have to think about, that's the thing that I have the biggest problem with. What am I eating today? Am I eating the right things for the type of activities that I'm doing, especially when I was pregnant? And then I was also dancing.
Yeah,
But being able to bypass a lot of those like yes, I want to advocate and I want to be able to have my autonomy and say like I don't want this or this doesn't feel right or whatever. But I also want to be able to trust the practitioner I'm working with that they know, and I think that's the scariest part is so many people they're just like we know too much and it's almost like we have to be on the defense
yeah,
because and I have to now go home and do extra research in order to figure out. And that's what I felt like I didn't have to do with the doctor who delivered my son is because
one,
he like you said, he was also not only was he an OB, he was a gynecologist, he was also licensed in what they call spinning babies. So if the baby got stuck, which my son did, then he's like, none of this is a problem for me. I've been doing this for over 20 plus years, like
yeah,
it was a no big deal. He had so many different skill sets because he really dove so deep and specialized into his particular
yeah,
field that he
yeah.
was able to grab all skill sets. And I think that's the thing. He was not, I mean, there was nothing general about him.
That's
And
it.
so I
Specific.
felt so safe, right? And I felt like I could just sit back and get the care and not even worry. And like, that's the best. And when you're in labor, that's the best thing that you need. You don't want to have to worry that the person's doing the right thing. And
Yeah,
same thing when you're injured, for our athletes, if they are coming off an injury and they're trying to get back to competing, that hinders their livelihood, their income, their student, clientele,
yeah,
their mental health because now they're not dancing, right? All of these things. And so knowing that you're not just like using them as a guinea pig, like, oh, we're going to try some things and we'll see if it
yeah.
works, right? I think
I,
that's what we've come across a lot more often.
the best thing about working with dancers is the our treatment protocol is so sport specific to them.
Yeah.
It's like bringing your vehicle in for regular maintenance. Uh,
Yeah.
you
I
know,
love that. Like an
and
oil change.
it's an oil change, it's
I
a
love
tune
that.
up, and
Yes.
it's a high quality car at that.
Yes.
The amount of time that dancers spend on their feet, not only practicing for their shows and their competitions, but with the pro-am,
Right.
is it
Right.
is just crazy. I don't think I've met many professionals that work harder than ballroom dancers. And in fact, it's to the point where I've given some of my friends, like I pull them to the side, like, hey man, maybe you should take some rest there. But at the same
Yeah.
time, uh, they have their own understanding, and I'm fortunate to know some of the best dancers in the world, um,
Yeah.
because they work harder than anyone else. Some of the people that you named before, um,
Yeah.
and some that haven't been named for sure.
Yes, yes, yes. Oh no, absolutely. Yeah, it's I feel really blessed to have grown up around this industry, excuse me,
Cool.
and just been, in the presence of so many incredible dancers that have influenced me. And that's why I think I love doing this so much, is because this feels like a way to give back to an industry that gave me so much.
Yeah,
And and it's really about the connection. I really want to be, when people are seeking answers, I want to be the one that has the answers because no one's really providing this kind of stuff for anybody. And people have to go and find referrals and test drive some things, and that didn't work. And let me try again. And it's like
mhm,
finding a good therapist. It's just so annoying. And so if we
yeah,
know already that we've vetted these practitioners, these ambassadors, these vendors, right? I just added this month, we're going to be adding a new vendor partner. She has patented inventions that help with things like plantar fasciitis and like specifically for feet. And she
Oh,
talks,
awesome.
it's amazing. And so she talks so much about the fascia. And I was like, why
Yeah.
is no one talking about the fascia?
Mhm.
That's a conversation. I like it was one of the first, and then all of a sudden I start talking to her, and it's like the red car concept. Now I see it everywhere, right?
Yeah.
And it just goes so much deeper, literally and physically, about than what we've been trained to learn about our bodies. And as athletes, we are naturally getting a better understanding of our body. But we still are searching for, like you said, those specialists and those people who
Mhm.
can customize the care to us. And like you said, it is something that is still developing because it is not, I do believe a lot of this stuff exists more in European and Asian countries as far
Mhm.
as like some, I've heard, I'm from Europe, so a lot of people that I know over there, they're like, oh my gosh, yeah, we have this person that they do this, or I know people who have had children in other countries that they're like, oh my gosh, and we stay the whole month, and they've got the universal health care and the this and that, and so uh, it's it's just a matter of understanding what it is that you need and being able to advocate for that. But then where do I find these people? Okay, so now I know
Yeah.
I need this, but now where are they? Right? And I think that's what
That's
you
what
and I are able to do is be
I was
like,
gonna
we
say.
have them.
You're building it.
Yeah, we're trying to do that. And make it just easier so people don't have to stress and research and do all the things of like, how do I find these people that I can trust?
Mhm. Yeah. I think what you guys are doing is amazing. I'm happy to be a part. I'm so glad that Tony put my name in the hat, uh,
Yeah.
because you're creating a hub of information that plugs into these practical fields for people to access. It's great.
Yeah, thank you so much. I appreciate that. Well, I am just honored to be able to meet you and just for you to take something that was such a gift to you and see it in action when you were in college to be able to, I'm sure there much more that went into it. That was probably just an inspiration point, but for you to take all of that and then run with it and create what you've built. And honestly, even just going in your facility, I can tell that it was just the tip of the iceberg. You have so much more that you're developing that is going to become a reality here in the coming years, which
Yeah.
I'm very, very
Stick
excited to see.
around. Hang with me. Stick around. We're gonna
That's
be
it.
friends.
So let's talk about what this means, our, collaborating together. So first of all, if you are in the San Diego, La Jolla area, this facility is a place that you need to visit. If you are not just an athlete, you help everyone, but specifically you work with athletes, and that's who our community is really helping people that are using their bodies as a tool. Where you are located specifically,
We are in the UTC area. So our address is 8939 Via La Jolla Drive. Um, but if you're familiar with the UTC Mall, we're
yeah,
practically walking distance. UCSD, the university, I'm looking at it from my office right now.
yeah,
Uh, so we're right off of Via La Jolla Drive in La Jolla Village.
very
Uh,
cool. Great location.
yeah, I know there's some dancers out here, and if I were just to give like an example day
Uh-huh.
of
Yeah,
of what I think a dancer should do. First of all, I think every dancer, within reason, should be doing something to maintain some skeletal muscle. So, coming in and doing something corrective or progressive in nature is something that should be done. But nevertheless, knowing the schedules, I say, hey, you have your morning sessions with your pro-am. If you're doing that,
yeah.
you come by, you see one of our practitioners, maybe a corrective exercise specialist, a PT, get stretched out. A lot of the dancers have hip and back and knee issues, so do some
Mhm.
spinal decompression on one of our advanced systems, the traction table. Uh, from there, I would go see a massage therapist. Uh, that relax, do lymphatic drainage. If
Yeah.
there's some hydration needed, maybe go into some IV therapies. From there, if you're dealing with an issue, actually see one of our practitioners like chiropractors or physical therapists. Uh, Spend some time in the cold plunge and or the hot tub or the steam shower. I think all those things kind of be used interchangeably, followed by
Hmm.
some infrared sauna. Um, go down to our nutrition and metabolic center, have your supplements, whether it be your collagens or your proteins, your peptides, put into a meal prepared by a professional chef. Go and get your meal, eat it, get back to your day, and you can come back and do it again later. That things like that's really the flow that I see and care to enjoy myself, as well as using hyperbaric oxygen therapy. I think
It
that's
feels like a medical spa. Like
yeah,
it feels like I just get to come and just be, especially if you're not, working through a very severe injury.
hmm
If you're just doing, because I think that's the biggest thing about these types of spaces that you're creating as well, is it's making people more knowledgeable on the preventative side,
hmm
right? That you don't want to get to a place where you are so burnt out. And because that's what we're seeing a lot of is we're trying
yeah,
to recover people when in reality, if when we start with some of the kids, it's like they're so healthy and ready to
yeah,
go that we're teaching them how to be preventative with these things so that those things never occur. And if they do occur, they're not as severe as if your body's just depleted and exhausted.
yeah, yeah. Now, granted, if someone does break down,
Mhm.
hey, that's when you see me. That's where I come
Yeah.
in.
Yeah.
So we fix them as well. But I 100% agree. I think that the onus has to be put on what prevention looks like
Yeah.
on a day-to-day basis, so that we don't end up breaking things down to the point
Mhm.
where we can't use them anymore.
Yeah. Yeah. And just overall energy when you're talking about hydration, lymphatic drainage. Oh my gosh. Like that
Yeah,
is like those are things now that are just becoming more common verbiage around what we're like if you're not doing that, like these are things you need to be doing
yeah,
regularly, especially if you're an athlete.
absolutely. I think that I think it's fair to say if you're not looking into those things and you're serious about um, the performance that you're in, you're missing.
Right.
You're missing
Yeah,
out
right.
on everything you can do.
I agree. And now we have places like this that can offer that, which I think is amazing.
Yeah.
How does it work with your memberships? Like, is it like a gym? How do I come in and like if I wanted to use your space maybe 3 or 4 times a week, what does that
Mhm.
look like for me?
So some people do utilize the patient member tuition similarly to what they do with a gym membership.
Right.
Uh, because we do have a world-class, beautiful performance floor mixed in with our sports science area. I don't think you can find better machines or more biomechanically efficient floor space anywhere.
Hmm.
Um, but all of those people are also our patients.
Right.
So, if you do need to come in for something in particular, like, ice stim therapy, that's not going to cost anyone. If you're doing like one-on-one FaceTime with a practitioner, 15, 20 minutes, we typically don't charge anything for that because you're in our care and we want you to be at your base. By the time something goes into a deeper scope, then you start billing. Um, some of the technologies that I mentioned earlier, like the cold plunge, uh,
Yeah.
hot tub, cryotherapy, hyperbaric oxygen therapy. If you're on any type of performance training program or rehabilitative program, those things are included because they're oftentimes prescribed. But if you do a $50 add-on to your $60 membership, you can get access to those things by appointment, unlimited. Yeah, so
Very
uh,
cool.
yeah, pretty accessible. 59.99 is
Yeah.
our month,
Yeah. And I
and then
can come and use, like you said, you've got all of the state-of-the-art machines to be. I mean, basically, I'm sure some of your clients use it as their home gym as well.
yeah, yeah. I have people here, and if they see this, they're gonna see me talking about it. But I got some people here who live in the area. They just walk over. They use our place. They
Yeah.
shower, sauna,
Yep.
steam shower, and
That's
walk out
awesome.
straight home.
Yeah.
they feel very, very welcome and comfortable here. All of our showers are private, so it's one room, one person.
Mhm.
for cleanliness, and it's easy for people to spend a lot of time.
Yeah, right. I was gonna say, I don't think I would ever leave. Like, you might need to just set up a cot and like,
That's
it just sounds
what,
so glamorous.
that's what the lounges are for. So yeah,
Yeah, I love that. Yeah, it's amazing. It's absolutely amazing. Um, I am so excited to be able to meet you, to know more what you're doing, to know that this stuff is already in existence. Because
hmm
again, what we're doing here with our community is to try to connect all the dots here.
yeah,
Is, I'm not trying to reinvent the wheel unless the wheel isn't invented.
yeah, smart,
And
not
if
harder.
it's already here, let's just make sure we get the right people in the right place and connect them together. And so that they know, I am the girl who does all the research, and truthfully, it's exhausting most days. I would prefer to have, you know, talk to the right people and just cut the corners. And now with all the technology and AI that's coming out, we are able to do that more often. And specifically for our athletes, I think that athletes, I always say this, that the most advertised and biggest of stages on the planet are all centered around athletes, is the
Yeah,
Olympics, the Super Bowl, FIFA World Cup. Like, all of these things are all centered around athletes, and people gravitate in masses to see athletes perform. And yet when I started digging into how much support is given to these athletes, even at the highest level, I was surprised to see what was still lacking. And I'm so grateful for people like you to be able to have you as a resource, to know
yeah,
that, there are solutions for us.
we're grateful for you too. I mean,
Yeah,
just having a conversation with you and your husband, I mean, you're extremely knowledgeable and
thank
passionate
you.
about what you're doing. So honestly, I'm just riding your wave right now.
Hey, let's go.
Yeah.
Write it together. This is amazing. All right. Well, listen, for those of you who want to know more about what Philip does, where he is, I'm going to put all of the information on how to contact him in the show notes. Obviously, this is just the tip of the iceberg. We do live practitioner calls every once in a while, so we might jump back on if you have questions for Philip or anything, related to what we're doing here. Please let us know. We're happy to answer any of those questions. We're all going to be in the app doing all the things. You can join us at dancewellnesscommunity.com. You can join the inner circle and have access to everything, all the practitioners, our live calls, our self-care tools, our newsletters, everything. And we'll have, some connections, some with joining as well if you want to join the facility if you're in the area. Um, but also, who knows? Maybe we'll bring Philip on the road.
Hey, I gotta speak to the guys over at like Beach Bash, but I think it'd
Yeah,
be a great thing just to kind of set up like a healthcare tourism opportunity for everyone that's in town and coming through. So, and you're gonna be here for like a weekend anyway. You might as well
yeah,
maximize your health while you're here.
I
Uh,
love that.
be able to have something reciprocal where you're not being charged, $1 million while you're in town. Just something
Yes,
that,
yes, yes.
and we got plenty of space for you.
I love it. I know your space is amazing. I mean, if you're in the La Jolla area, just to go pop in and say hi to Philip and said, I heard you on the podcast. I got to see your space. Because that
Yeah,
alone is already worth the ticket.
we'll be happy to see you and serve you.
Yes, 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 yes. Amazing. Thank you so much for everything, Philip. I appreciate you taking the time to chat with us, and welcome to the team. We are going to do so many amazing things together, and I can't wait to promote you and do all of the wonderful things with our community, and for our community to be able to be served by you. It's going to be wonderful.
Yeah, I'm really excited, and I'd love to be connected to some of the practitioners that you mentioned, especially
Yes.
the woman that has the patent on the fashion products. I think
Yeah.
awesome. So I'm
Yeah,
looking.
very, very cool.
I'm happy to be
Thank
inside
you.
the tribe.
Yes, amazing. All right, guys, thank you so much, and we will see you next time.
Uh huh.